in 2018, I believe, there were over 8,000 drug recalls. And some of those drug recalls included some drugs containing carcinogenic substances. Okay, the fact that some drug companies are actually creating drugs that kill thousands of people, and all they have to do is simply pay out a portion of the billions of dollars that they've made. It helps you understand that since nothing is being done about what's being allowed, then the government is essentially a part of the problem. And when you start to think about where our dollars are being sent, I mean, look at what happened with, how much money we've sent to Ukraine. We've sent over we sent somewhere around $80 billion, and we're wanting to send another $250 billion, and then more money to Israel as well too. And when you start to think about inflation, how what you were paying for in terms of food in 2021, 2020 versus 2024, every American, if we were to adjust for inflation, every American would need at least $11,400 more dollars to adjust for the cost of inflation. How everything has increased. Insurance premiums, food, everything has increased. For us to adjust for that, what has happened in the last 3 years, and the government was definitely a part of that inflation, every American would have to increase their income by $11,400. Okay? So we have a governmental system that is so broken that it doesn't even realize that it should be positioning the people to not only be healthy, but to have necessities in life that are affordable. Okay? The next thing is media. This is one of the things that I noticed leaving America for over 4 or 5 years, 5 to 6 years, and then coming back. When I was living out of the country, I didn't watch much TV at all. I've never had a television. Well, I don't want to say never, but in the last 15 years, I have never had a television in my room. And when I was out of the country, I only watched movies or specific documentaries that I wanted to watch. So coming back to America for the first time after like 5 or 6 years, when I get here, I'm seeing commercials. And now I'm seeing commercials with a totally different lens. And what I'm realizing is that between the programming, which is what television is programming, between that programming, I'm watching the commercials. The vast majority of the commercials are fast food, okay? The other commercials that you're seeing are drug commercials, okay? And many times the commercials are repeating, okay? So the same commercial you saw at the break before, you're seeing that commercial again. This is why I'm saying that it's programming. You'll never see a commercial for a salad. You'll never see a commercial encouraging people to get out and exercise. You'll never see a commercial for people, saying, hey, use these plant remedies. You'll never see commercials like that. But you'll see a commercial for hamburgers. You'll see a commercial for hot Takis. You'll see a commercial for Fruity Pebbles. You'll rarely ever see a commercial, and I can't think of one, for healthy food. And you have to understand, whatever you listen to, whatever you constantly look at, it is going to program you. Okay? As a matter of fact, in a lot of POW camps, that was part of the interrogation practices, was to make them watch and listen to the same message over and over and over and over until it was so embedded in their head that even if they were to the far left of the message, at some point, because they've heard it and seen it so often, their mind would literally filter in that this is the right thing to do, or this is what I believe in. And when you start to think about, there's only 6 media companies. 6 media companies, well, it's not only 6, but there's 6 media companies in America that make up 90% of US media. Okay? And the vast majority of those messages are the same message being repeated, being programmed into us. So every time our kids, and most of those fast food commercials, they're targeting our children. We're already programmed as adults. We have to unravel the programming. Okay? So when we see the commercials, it's just reinforcing the programming. So the commercials are made for our children to indoctrinate them, the drug commercials. So then they get used to saying, hey, when I get sick, this is what I go get. Because otherwise, think about it for a second. In America, you can't write a prescription. The only person who can write a prescription in America is a doctor. So why do we need to see the commercials? And the reason why that is because they know if we see the commercial over and over, we'll go into our doctors and say, hey, write this. And then if they don't write the prescription, they'll go to another doctor. So guess what doctors do? They just decide to write the prescription. So then they get to keep their patient. Okay, so it's hugely important to understand that the media is also part of this system that is keeping us sick and obese and depressed. Because when you think about it, you never see good news on news anymore. It's always sadness, horrific, this horrific thing happened today. This shooting happened. These people are getting at war. It's always horrible messaging. Okay, so it's programming us to be in fear. It's programming us to want fast food. It's programming us to say, when I get sick, I need a drug. Okay, part of the system. All right. The other thing that has been a huge part of the system and how it keeps us sick is healthcare. When you think about healthcare today, and again, I come from healthcare. I've been in healthcare for over 20 years. And what I can tell you is this. It's not what I thought it was, to say the least, and to be nice. But one of the things that I learned about healthcare was the fact that the third leading cause of death in America, is medical error. Let me explain what I mean by that. And this isn't just something, I'm saying without any backing. According to the BMJ, which is the British Medical Journal, preventable deaths due to medical error accounted for somewhere around 400,000 deaths. That's around 62% of all hospital deaths. Okay? Preventable, most importantly, preventable deaths, according to the BMJ, British Medical Journal. Now, the reason why that's so important is because you ever seen like the cartoons where people are like walking off of a plank into the water or diving off of a mountain into water or whatever it may be? We're literally walking ourselves into an early grave. And we're in a system, and specifically in this case, I'm talking about we're in a healthcare system that unfortunately is a huge part of the problem. And nobody is addressing this pink elephant in the room. Nobody's trying to understand why medical error, preventable deaths in the hospital, under the care of healthcare professionals, preventable deaths like they got the right drug, the right surgery, the right drug at the right dose. Everything was done right, and the patient still died. Why is that the third leading cause of death? You have to think about that for a second. Okay? There's only 2 above that. So essentially the third leading cause of death being the hospital, being medical care, it shows you that the system is a part of the problem. And when you think about it, I want you to think, and I mention this example all the time, when you go into the hospital, it doesn't feel like someplace you want to be. Most people are afraid of the hospital, and it's a healthy fear. And when you go into the hospital, if you're an inpatient, look at the food that they give you. Okay? Look at the risks that people sort of expose themselves to when it comes to hospital-acquired infection. Look at those numbers. How many people are actually getting an infection by actually going to the hospital?